it reproduces and release by feces to soil. Someday it remain alive and spread via the wind from here to another place. And in this condition, inspiration and inhalation, the spore usually, sometimes or seldom, orally leads to infection. The way of transmission are inspiration, inhalation. Sometimes via contaminated food and water, the way is orally. It needs predisposing factor. The main person is HIV, AIDS, and diabetes. It is important in this group. And recipient of organ transplantation, recipient of organ, because you must immunocompromise, immunodepression the recipient. In clinical type, in clinical manifestation, you have pulmonary infection, like as aspergillus, pulmonary infection. Usually, pulmonary infection is subclinical without clinical sign, usually. And the infection go to CNS via the bloodstream. We have CNS infection with aspect of meningitis, meningoencephalitis, and cryptococcosis. Cryptococcosis is a tumor-like lesion that involve the brain. The most common type of CNS infection is meningitis. When we have meningitis, we have headache, we have convulsion, we have blindness, and the last time we have coma. And if we haven't treatment, lead to death. In clinical manifestation, we find cutaneous infection. Sometimes patients show cutaneous infection. Sometimes the bone involvement show in this infection, bone involvement. And in diffuse infection, we have visceral cryptococcosis or systemic cryptococcosis. It is a schematic of involvement of main organ. One of them is brain. It is dangerous for, but lung show subclinical, not acute form of infection. The main infection involve brain, and it is dangerous if we haven't any correct diagnosis. We have a patient with headache. I don't know. It is viral, bacterial, fungal. Therefore, we must prepare the CSF and examine and check the CSF for identify the Cryptococcus neoformans. And after start the treatment. Maybe we have an imaging finding. It is not specific for diagnosis. It show cryptococcal lesion, skin cryptococcal lesion. It is not specific. You must prepare sample, prepare biopsy, and check with microscope and culture it. It is a lesion in hand, in a skin. Another slide, like as this. You must prepare biopsy and check it for diagnosis. Pulmonary infection, subclinical CNS infection, important. Commonest type is meningitis, May meningoencephalitis, and May cryptococoma. Cryptococoma is a tumor-like lesion. Cutaneous lesion, we see the picture. Osseous cryptococcosis means bone involvement and systemic form of cryptococcosis. Okay, this infection is for diagnosis. You must check the for diagnosis. You must check the sample. If you have brain infection, you must check the CSF. If you have pulmonary infection, you must check sputum or BAL. If you have a skin lesion, you must prepare a specimen and biopsy and examine it. In laboratory, you have two ways for diagnosis. Both ways are important, direct and culture. Both ways. Direct examination of the specimen by Indian ink or Chinese ink. It is a well-known test. It is well-known test. A physician requests, please do Indian ink. It is enough for diagnosis of cryptococcosis. Indian ink. How much? Oh, serology. Yes. How about serology? In serology, we because there isn't usually uh, antigen kit or antigen test. Usually there isn't. The main way is COOH and culture, but agglutination test latex. If you have antigen kit, it is useful for diagnosis. In direct microscopic examination, you must find in Indian ink capsulated yeast, and you must isolate Cryptococcus neoformans from media. Both ways are neat. Both ways are neat. In Indian ink, you find white circular shape of fungi in dark media. Indian ink is dark, okay? And when you have Cryptococcus neoformans with capsule in this specimen, you find circular with budding or without budding, white circular element in dark media. Capsule show itself white, or in this picture you have yeast with budding, yeast with a sharp capsule, white capsule around it in dark media, or in this picture. For diagnosis, you need culture and isolate the Cryptococcus neoformans in media. It is a form of colony that must be checked. Sometimes you need, sometimes may you do serological test by latex agglutination, but it is not prepare always. It is a good technique, but it is not always uh, available. After diagnosis, you must treatment. You have treatment. At first with amphotericin B, second with azole. For example, itraconazole. It is important, attention please, it is important for diagnosis, for treatment of this infection. In, it is important after complete treatment and healing, you must check the CSF again, and you have any cell, any yeast cell in CSF, you must have a negative result in culture, in direct examination. If you have changed the amount of yeast, it is not enough. I think it we have 100 cell in microscope. After the treatment changed and uh, down to 20 or 10, it is not complete treatment. You must need negative result. Also, one cell, it is dangerous, it is chance to recurrence the infection, and you uh, uh, in this condition, in recurrence, and when you have again clinical sign that treatment is difficult, more difficult compared to first. Yeah, no resistant. It is not resistant. The body is weakness. The body is weakness because body immune system help to treatment. Okay, when we have a negative resistance, the treatment is complete in this infection. And in last, we have mucormycosis. If we find it, oh yes, mucormycosis is the last file or listen or disease that we must explain.